Mr. Gerald Giam suggested the government was not forthright with the people, or that's what I heard, that during the initial stages of the pandemic, we did not impose mask requirements, not because of public health reasons, but because we did not have enough mask supplies. This is incorrect. In the initial stages of the pandemic, there was no clear understanding of the characteristics of the COVID-19 virus. We therefore align our policy to WHO's recommendations. And WHO, even up to March 2020, maintained that, and I quote, "A medical mask is not required for people who are not sick, as there is no evidence of its usefulness in protecting them." Unquote. The risk of shortage of masks for healthcare workers will put their lives in danger because they are in the front line. Is it a serious concern? It was. But it was not the basis of the prevailing public policy on masking. We aligned our policy with WHO. We reviewed and changed our masking policy in April 2020. That was also when WHO changed its guidelines, once the evidence on how the virus spreads become clearer. Particularly, there was now clear evidence that there was asymptomatic transmission via aerosol. Nevertheless, as acknowledged in the white paper, the whole issue of masking is one area where our decisions could have been better. But no question that during this period, government was totally forthright with the people and told the people what we knew.
Mr. Gerald Giam asked why we did not have sufficient stockpile of masks and local production capacity. Prior to the pandemic, masks were rarely worn outside of the clinical environment, even during SARS. Our national stockpile of masks was therefore maintained at a level that would be sufficient for the healthcare sector's needs. To supplement our stockpile, Singapore companies produce masks overseas, and it is more cost-effective to do so. Therefore, when we decided to require everyone to wear a mask whenever they left their homes, we had a problem. We were faced with an unprecedented situation where everyone in Singapore and around the world was suddenly looking for masks for daily use. In Singapore's case, we were looking at a utilization rate of more than 5 million masks each day, around the number required by the public healthcare system for 1 month. That's 30 times more than our usual consumption. We worked very quickly with the private sector, such as ST Logistics, to source for additional mask supplies from around the world. At the same time, we worked with industry partners, such as ST Engineering, to quickly set up surgical mask production capabilities here. The first batch of made in Singapore surgical masks was produced in February 2020.